Good morning, everyone, and welcome to Henry County Chamber of Commerce Community Dialogue. I am Judy McMurtry. I'm the chair of the Henry County Chamber of Commerce Diversity, Equity, and Inclusion Committee. I'm also the member of the board of directors for the Henry County Chamber of Commerce, and I'm the host of Community Dialogue. So I would like to welcome our Zoom participants as well as our Facebook Live audience. Thank you for joining us today. I would like to introduce, starting off with Christy Chuning, who's joining us. She's the co-host to Community Dialogue, and also our special guests that we have with us, Shaylin, Thomas, and Ravi. So if we can go in the order of Christy, you start off.
Yeah, good morning, Judy. How are you?
I'm great.
Good. Just excited to be here. This is a great topic that we're going to talk about today. And I really want to recognize Kaiser Permanente, and I'm thrilled to have Kaiser Permanente actually on because they have been sponsoring the community dialogue for us. And so it is great to have them. And I'm going to let you guys go ahead and introduce yourself, and then we'll get into it a little bit later.
Good morning. I am Thomas Williams with Government Relations for Kaiser Permanente. Also, I serve on the Henry County Chamber of Commerce Board of Directors and Executive Committee. I'm glad to be here today.
Thank you. Ravi?
Hello, I'm Reve Graham. I am the Senior Communications Coordinator here for Kaiser Permanente in the Public Relations and Communications Department, and I am happy to be here once again this year with all you lovely people, and good morning.
Good morning. Shaylin?
Good morning, everyone. My name is Shaylin Dixon. I am the CEO of Scale Logistics. I also am the Women's Leadership Council Chair, and I sit with Thomas and Christy on the Henry County Chamber of Commerce Board as well. So thank you for having me this morning. And Kaiser, it is amazing to have you all here. You've done so much for us. So we're really looking forward to this conversation today.
Okay, sure. Can you share a little bit about what's coming up in March for the Women's Council?
Yes. So the Women's Leadership Council, we have an annual summit, our Women's Empowerment Summit, and it's more than empowerment. Our theme this year is Rise, Reclaim, Reimagine. I know a lot of us for Women's History Month have attended other events, but ours is unique. We bring industry leaders, people who are successful, who have gone through some challenges. And really our goal is to not just give empowerment, but to acknowledge the things that we've gone through, be able to reclaim our power, and then get strategies and tips to reimagine the future for ourselves as women, right? Because empowerment just in words is just in words. We're all about action with the Women's Leadership Council. So we're really excited. We have some phenomenal speakers. Not only locally, but in the metro Atlanta area. We have Aubrey Kawiki. She's our morning keynote. She is the CEO of Southern Grace Hospice. So she's local. She's doing a lot in our community. A lot of us know her. So I'm really excited to hear her story of how she's overcome and how she serves the seniors in our community. We also have Cami Mackey, who is our afternoon keynote. She is the Chief People and Diversity and Equity Inclusion Officer for the Atlanta Hawks and State Farm Arena. So I'm really excited to hear her perspective. She brings a unique story of course, she's in a male-dominated industry, right? Sports and in arenas. So I'm looking forward to hearing how she's overcome. And we'll get more into our power panel, but I'm so excited just between our speakers and just our theme this year. I'm really looking forward to everyone leaving with something powerful.
And what date and where is the location of it?
Yes, so it's on March the 7th. It's an all-day event, so bring your laptop, whatever you need from 8 to 3. It is at Merle Manders in Stockbridge. Tickets are on sale, so everyone, feel free to get it. It's the last 2 weeks. It's a heavy push for us to make sure that we get the people who need to be in the room. Last year was amazing. And honestly, one of the parts that we don't advertise enough or we don't speak about enough is that at the end of the day, we give away 2 $500 scholarships to some young ladies who are female students in Henry County. So not only are we empowering them, inspiring them, encouraging them to rise and reimagine their future, but we're actually giving them a monetary amount, 2 award winners. And I mean, they didn't just, throw their name in a hat. They wrote essays, they presented themselves. So it's always amazing to hear the accomplishments of the young women in Henry County and be able to contribute to their success.
Okay, thank you. Thank you very much. Christy,
Yes.
you're going to welcome a special guest here?
Yes, one of the things that we did want to talk about and just recognize Kaiser Permanente for was the support of our Small Business Resource Center that is housed at the chamber office. And it is a great thing that we have for small businesses to come in and use if you need an office for a day, or the training that's happening in the center is just unbelievable. Judy herself just led a training recently. And so, it's a great resource for those in Henry County that have small businesses. And we just want to thank Kaiser so much for the money that they've put into that. And then also in 2023, there was the Women's Empowerment Summit that we had Kaiser Permanente's president, Pam Shipley. She was the keynote speaker, and they made a $10,000 donation. So I don't know, Rave or Thomas, you guys want to speak to that and about that program?
Yes, I'll speak to it right quick.
Mhm.
The program at the Small Business Resource Center is to me is near and dear to Kaiser Permanente, because 77% of the people that are attending workshops that are going there are women-owned businesses or potential women-owned businesses. So that is something that is important to Kaiser Permanente, and we just treasure our partnership with the Henry County Chamber of Commerce, and we're very proud of the chamber and its leadership, and its staff, and its team. And I think in 2022 or 23, they were voted on nationally as the Chamber of the Year. That is a big deal. To be on a board of a chamber of commerce that is considered one of the best chambers in the United States. And we don't take that lightly. We take our partnership seriously, and we are proud of our partnership with the Henry County Chamber of Commerce.
Awesome.
Yeah,
ahead.
absolutely. Absolutely. As Thomas said, we are very proud of our partnership with the Henry County Chamber. As Christy mentioned last year, we had Pam Shipley, who was given the honor to be the keynote speaker at the Women's Empowerment Summit in 2023, where we gave our $10,000 contribution. And I believe a couple of months ago, I had the opportunity to actually sit down on one of those trainings where they went through that was able and made available through our Business Resource Center. So it's good to see that that money is being supported and used effectively in the Henry County Chamber as well. And even though we are not the keynote speaker, we are still supporting Henry County Chamber in all they do for the women in the community every step of the way. This year, we are still a presenting sponsor, and we will have our COO, Heidi Veltman, there to help kick things off this year for this summit. So we are still excited to be in partnership and look forward to all the great things the summit has to offer this morning as we imagine how we work with our partners and how we show up at the community. And we just thank you so much.
Oh, and we thank you as well. And just so we don't forget to mention this as well, you support this community dialogue, and you have supported it since it's been ongoing. Since what year was that, Christy? 2021 when it started?
We started in 2020, and we started with reading books and with a book club, and then it kind of morphed into what we're doing now. So yeah, Kaiser has been along with us just about the whole way from the beginning. So we're really happy that Kaiser Permanente can partner alongside us and show their support of the Henry County community. And so, yes, thank you very much.
Yes, thank you. And at this point, we just really want to emphasize enough for the Women's Empowerment Summit. I mean, I know, Shaylin, you described it, but I have been a participant of this summit, and it's really been very powerful the entire time that I have been a part of it. And the expo, you have 18 expositions that's going to be a part of that exhibiting their products and their services. And I'm excited when I saw that list. I'm like, wow, that's a lot of people that's going to be able to provide an extension, even more so, of what the front stage is offering. You can go down and then you can enjoy, and you can talk to other business leaders in that space and see the products and services they provide and support as well. So, and just the networking opportunity as well that you have from the Women's Summit. You have a powerful group of people in one location that you could come together, and collaboration. We don't talk about that word enough, collaboration. You could come and see who you can meet to collaborate with. That's huge. What do you think, Christy or Shay?
Yeah, so a part of the Women's Expo, the Summit Expo, that we're really looking forward to is one, not only being able to support, again, in action, our local business owners. A lot of our vendors are women as well. And these are small business owners. So being able to support them financially through like buying their products and services is huge for them. So being able to give them that space, it'll be downstairs. So we're really excited to get everyone to take their breaks and go down and do a little bit of shopping. We are giving away a giveaway for anyone that enters to win. So anyone that enters that expo hall, they'll be entered to win a gift card, $100 actually. So we're looking forward to that. So it's a win-win. You can shop, find things for your loved ones. Mother's Day is coming up, Father's Day. And then you'll also be able to enter the win. One of my favorite aspects of the actual summit is our wellness breaks. So after we return from each segment, we have our keynote and afternoon speaker. We also have our power panel, which I'll get into because that is always a hit. Our wellness breaks are in between. So when we return back into the main conference room, we'll be giving out affirmations and giving away items from our local community partners. And so we're excited about that because who doesn't like to receive an affirming word? And also the opportunity to get some type of gift and leave with something. So I always enjoy those. Brenda Smith puts those on. So that's an exciting part as well. I know, Judy, you were there last year. The women were excited, right?
Oh, absolutely. And it's
with
growing. Each year it grows, and it's amazing. You have to talk about that power panel. I'm sorry, you just need to talk about that power panel because it is a power panel.
we bring together just an eclectic array of women with different stories and different challenges and different obstacles, different accomplishments. And this year, Dodie Kaysen with Southern States, she is our former chair who actually started all of this. And I'm just following in her footsteps. She's our moderator. So I'm looking forward to having her passion and her insights as moderator. But we do have three dynamic panelists, which is Marianne Sudith. She is the Chief Leadership Officer for Henry County Schools. Nicole Miles Sullivan, she is the VP of Operations at Atlanta Gas and Light. And then the Honorable Sandra Vincent, who is our mayor of the city of McDonough. So I'm looking forward to all of these women's inspiring and talking about having grace and standing gracefully through crisis and challenges. So I'm looking forward to the power panel as well. And Kaiser, thank you for being a presenting sponsor this year. We really couldn't do this without your sponsorship and your support, not only financially, but physically. You always have droves of people at the tables, and your support in action is just, we really appreciate it. And thank you so much.
And thank you. And I know, Shaylin, you have other obligations today, but we thank you for being a part of this wonderful dialogue. So, and I see we have Dr. Gibson here, Erica Gibson. So this is awesome. She's here to discuss as far as maternal health crisis in the U.S. and specifically more in Georgia. And they have this wonderful program, but I'm not going to steal her thunder. She's going to tell us a little bit more about this special program that's here to support women in U.S. as well as Georgia. It's amazing, especially African American women. So, Dr. Erica Gibson, could you just give us a brief introduction first, and thank you so much for joining us, as well as tell us a little bit more about your project you're working on.
Sure. Well, thank you guys for having me, and thank you for your patience as I was trying to log on to the Zoom link. My name is Erica Gibson. I am an OBGYN. I work with Kaiser Permanente. I work at the Cumberland office location, and I've been with the organization for 7 years. I did my medical training in Philadelphia, the University of Pennsylvania, so I went there for medical school. And then stayed for residency, was in DC for a couple of years, and was able to come to Kaiser. I actually applied to work at Kaiser in Georgia out of residency, but there weren't any positions available at the times. But the recruiter kind of kept my CV on hand, and so luck worked out, and I was able to come down and join the organization. So I'm a practicing OBGYN. So, I see patients and do deliveries and kind of practice full scope OB, obstetrics and gynecology. And I have an administrative role as well. So my administrative role, I'm the program director for perinatal safety and quality. And so I work with the Women's Services Department and our Department of Quality and Safety to evaluate, sort of how we are providing care to our pregnant women of Kaiser, Georgia, and really work on initiatives to improve both the care experience and our care outcomes. One of the things that we have been, really working on for the past couple of years is, really developing and fleshing out our cocoon pregnancy care model. And so all of this started really in 2019 when, we had, commitments really from, top leadership down to do a really deep dive into looking at our maternal outcomes and then, focusing interventions on, the maternal health crisis. And so I think that, when you look at just sort of across the United States, we are unfortunately in a maternal health crisis, and our outcomes, such as our maternal death rate, and even sort of those near miss experiences, are much higher when you compare our country to other, industrialized countries. And whereas other countries have seen their rates declining, in the U.S. we've seen our rates increasing, especially since 2020 and the COVID pandemic. Georgia, unfortunately, ranks second to last in terms of maternal mortality rate. So as a state, we, really do not perform well. And there's definitely lots of area for improvement. So, we recognize that and we wanted to, see where we could make some big changes, to improve care for our women and our pregnant patients. And so, we developed, a lot of different programs. Some of the things that, I'll highlight are, our remote monitoring programs. So, hypertension or high blood pressure is, a common comorbidity or a common complication of pregnancy. And we were able to, kind of create data sets where we can look at our patient population, really understand who our patients are. So we knew that we had, a fair amount of patients with high blood pressure, hypertension, preeclampsia, which is high blood pressure in pregnancy or in the postpartum period within the first 6 weeks. And so, we wanted to utilize technology, to help better care for these patients. So with our remote monitoring program, patients that are at high risk receive a blood pressure device, and it is Bluetooth enabled. So when they check their blood pressure at home and they have the app open, their blood pressures can flow directly into their chart. And so we have, a clinical team that's monitoring that chart, and monitoring alerts. So if we see blood pressures that are high, we can do proactive outreach, and really kind of intervene sooner, versus, if a patient, develops preeclampsia and gets much sicker. So, we have had a lot of success with that program. We've had over 2,000 patients since we started the program, that have gone through the program, and actually just published a paper looking at outcomes. And so we found that, when our patients are monitored in this way, particularly postpartum, so after delivery, our patients have better blood pressure control. Our patients are more likely to see a doctor. They're more likely to have, to be on medication, and they're more likely to see a primary care physician. And so all of those things are really important, because when you actually look at things like maternal death, most of maternal death actually happens in the postpartum period. So, having better control of blood pressures, and just having, that like interconnectedness with OB and with their primary care physician, I think is ultimately going to make a really big impact. So, we have our remote diabetes program. We have developed a team of maternal child health nurses, that are doing check-ins on all of our patients once they've delivered, really within, the first couple of days of going home. And that was a shift we made from, pre-COVID. They were actually going to the home, to see patients after they delivered. We've developed, a really robust wraparound service for our patients. So that includes, behavioral health therapists that are really dedicated to, our moms. We know that mental health is a huge, issue across all populations, but especially for our pregnant moms, especially in the postpartum period. I think our patients are really well informed. They, know about the maternal health crisis. So a lot of patients are coming in and they're really anxious, and just kind of scared being pregnant. So we have these folks who can really help, support our patients. We have a social worker who connects our patients, with needs. Some of our patients may have, issues with housing or transportation or food stability. And so, she's our link and is able to connect those moms to the resources that they need. We have a community navigator who, helps with the patients, just like navigating a really complex, medical system. They have a lot of appointments. They have other kids that have appointments. So, just someone to really kind of hold their hand, and walk them through the process and navigating our systems. We have a dietitian. So, patients with diabetes and other sort of medical conditions, that she helps, develop care plans for them. But she also just helps with general nutrition, lots of questions about, what I should be eating, what I should be eliminating, and she's developed some great courses, and classes, for our patients. And we have a case manager as well. So, for those high risk patients that, again, there's, a lot of touch points, a lot of things that we need, to sort of check the boxes to make sure that we're on top of patients' care. She helps with, making sure that our patients are on top of that. And she really, has this great like mama bear, rapport with patients, and she has their phone numbers and they text her pictures when they have their baby. And we get a lot of really good feedback just about the level of support that our patients feel like they have, throughout their whole pregnancy journey. So, that was a lot, but you kind of condensed, sort of several years work into, what we've developed as, this cocoon model. And really the model, puts the pregnant patient at, in the center. So we're really, centering that, patient, and her needs and experiences and that of her family. And then really surrounding, that patient with, different levels of care, from like the clinical care that she gets from her team, to, sort of other supports that we've developed in the system, our, maternal child health team, lactation support, the remote monitoring programs, making sure that we, have created guidelines that are very evidence-based and using, sort of best practices in the hospital setting, in the office, and then, really robust wraparound supports to really sort of try to hit every angle that we know can impact maternal outcomes.
Now, since you've put this program into place, what is the difference as far as the rate? Have you seen a significant decrease using this program?
Yeah, so that's a great question. It's something that we are continuing to look at. I think for some of the outcomes, looking at things like mortality, those are overall actually very low like numbers when you look at those. So it's going to take several years to really be able to see those impacts. I can definitely say that we have seen definite trends towards, improved outcomes for mom and also for babies as well. So that's been really positive to see. Again, I think that, with the remote monitoring programs, we've definitely seen, a much better control of our patients, blood pressure with their follow-up. And then I think that one thing that's really important, to consider about outcomes is, also the patient experience. And so when we, have asked our patients about, their overall care experience, did they feel like they were supported? Did they feel like they understood, sort of what was happening to them? And we sort of looked at patients kind of, sort of before the program and then patients who have gone through the program. Our patients definitely, feel like they were more supported and felt more cared for during like being cared for within the cocoon model. So I think that the care experience is definitely, an important one, to highlight because I think that, more importantly, that's a huge piece of what our patients care about is, did they, receive good care, but also did they feel like they, had a team that, cared about them and supported them.
Okay, awesome. Now, have you shared this with the cocoon model with other medical institutions other than just outside of Kaiser, or is it just strictly a Kaiser Permanente program?
So we have shared the model. We actually wrote up our experience with the development of the model. And that paper was published in the New England Journal of Medicine, the Catalyst. So it's sort of a sub journal of the New England Journal of Medicine. So, a pretty long piece just about sort of the whole evolution of the program. And obviously that sparks, interest. So, I've been, to different conferences and have been able to, share our experiences here at Kaiser. And part of the cocoon model that I think, is great is that, we're very fortunate within, Kaiser to have an integrated system. And definitely, with having the support of our leadership for, putting all of these pieces into place. And, I recognize that, not everyone or not every sort of healthcare organization is, the same. And, some people are part of a big healthcare system. I mean, they may be seeing, their OBGYN in a small private practice. But I think that there are, elements of the model that, could still be kind of extracted and applied in, other settings. So that's been a lot of the conversation was, with different sort of healthcare organizations and other, leaders in the healthcare spaces, they may not necessarily be, like a Kaiser Permanente, but I think, there are elements of the model and really the aspiration of the model with, centering patient care experiences, improving outcomes by, sort of putting into play in healthcare systems certain programs, evidence-based medicine, and especially supporting, sort of the other needs of patients, the mental health needs, a lot of the social determinants of health needs. They can sort of pick those pieces and apply them in different settings.
That's good. That's really good. So what are some of the challenges in implementing the cocoon pregnancy care model that you experienced through this process?
I think resources is always, a big thing. We had to present, essentially a business case for every sort of new person and, sort of new technology that we had to add. And part of it was, we're able to use things like grants. So there's specific, grants that are aimed towards safety initiatives within, sort of the larger organization that we applied for and were able to tap into. Because once you can demonstrate that, these added resources add value, and that, the outcomes and patient care experiences are, improved, then, that sort of gives that return on investment that, sort of the business people want to see.
Right.
And we were able to really hold on to a lot of the resources that we added through that grant process. Again, I think that we're very fortunate in that we had the support early on. So our, organization knew that this was just the right thing to do, for our patients. And so we were able to, really sort of speak to that, that our moms and our patients deserved this type of care. I think that some of the other, challenges are, with our clinicians, we have a big organization and, a lot of the initiatives, like especially the remote monitoring, are really, sort of big changes in how, we had usually, had been used to providing care. So we had to, really get the buy-in from our docs and midwives, because they're the ones who are, enrolling the patients and, sort of following the guidelines that we put into place. And it's, it's a process, but, part of what we did, when we surveyed our patients about their experiences with the cocoon model, we also surveyed our clinicians to see, what is your experience with this program? Um, and our clinicians overwhelmingly, felt like, these programs improves the quality of care, that it's become sort of ingrained now that, people can't imagine, not having these programs, like not having, a therapist or not having, the ability to remotely monitor blood pressure. So, it takes time to, for people to kind of get used to new ways of doing things, but I think that they've seen the benefit, just in their ability to practice medicine, feeling like that the care we're providing, it improves sort of the safety, and that our patients really appreciate the program. So now it's just like a part of our culture. So those are some of the challenges that I can think of.
Okay. Now, through your study, did you break it down by age and ethnic groups, or how did you determine who had the most challenges in this area or the highest mortality rate?
Yeah, I mean, we do. One of the things that we've been really intentional about when we're looking at, things like data, is really sort of breaking down, our data and looking at specific populations, because we want to know, if there are disparities in outcomes, based on race, not necessarily as much on socioeconomic status, but those are things that, we can sort of develop ways of being able to sort of look at that,
Yes.
that would come in the future. And I think that, our data kind of follows along the same lines as, sort of what you see across the state and across the country. I think one of the things, and that was also sort of part of why, we were really focused on, specific conditions that we knew were a higher prevalence within certain populations. So within our Black patients and some of our Hispanic patients, like high blood pressure and diabetes. So we've been really laser focused on, those specific conditions, because we knew if we, really targeted, these conditions that, impact those communities, sort of more prevalently than others, that we could, make that dent that we wanted to see, in things like morbidity, and then ultimately down the line in mortality. And we've actually seen that since we've implemented the remote monitoring program. So that's something that, we're excited,
Yeah.
to see that's what we thought would happen is actually happening.
Oh, good. Great. So then that means you have that supporting data to show that the program is outstanding and it's doing what it's supposed to be doing to help women and decrease that mortality rate.
Yeah, we see, excuse me, we see, and that was, what we published in the most recent paper that was looking specifically at the remote monitoring programs. But, part of what we do is continue, sort of program analysis and improvement. And so again, taking a look at, sort of all outcomes across sort of the whole population, not necessarily those patients with hypertension.
Right.
Is definitely like our next phase.
Okay, awesome. Christy, do you have any questions?
I do. I'm interested in the remote monitoring just because I love all things tech. And is that something that is done across the board, Kaiser Permanente, with patients that might have high blood pressure or those with diabetes?
It is a program, that's available for like the non-pregnant population. So it's a big program in adult medicine. And I know that they look at things, the same sort of data points that we look at as far as, hypertension control. With diabetes, it's different than gestational diabetes or during pregnancy because we, sort of look at some of the data a little bit differently, but I know that they follow things like, hemoglobin A1C, which is, their sort of metric for, diabetes control. So it is available, for the non-pregnant population, the regular medicine folks.
Great, thank you. Yeah, we're sitting here and we're talking about medicine, we're talking about pregnancy, and we're a chamber of commerce, but this is our future generations that we're talking about. It's economic development. It is making sure that our next generations are healthy and well. And part of that is us being healthy and well as we go through those things. So thank you so much for sharing the cocoon model with us.
Absolutely. And I think just, sort of talking more about like that tie, to commerce, one is, what the impacts are of, a maternal death and sort of the huge ripple effects that creates, or, just a medically complicated pregnancy. I mean, we deal with that, on a daily basis and, having to take people out of work or, even afterwards in that postpartum period. And I think that there are also, economic impacts just, to pregnancy and the medical care, especially again in those medically complicated pregnancies. And so our, goal, and again, this is sort of a future state is, really sort of making sure that our women, as much as we can plan for it, are as healthy as they can be going into pregnancies. And we have such a huge opportunity, I think, in the postpartum period, because one of the things that I will say is that pregnant women are very motivated. They're motivated, they want to do sort of the right thing. They want to be healthy
Right.
during their pregnancy and afterwards. And I think it's a really, really great opportunity to tap into that, particularly in sort of that year postpartum. And so one of the things that we're really interested in, in doing is, developing, those relationships and programs where we can support our moms, past the 6 week, postpartum period, because we know that's not really when like postpartum ends. And just opt to continue to optimize their health because we know that what we're doing, is helping during, their pregnancy and immediate postpartum period, and just want to continue to, be able to offer that to patients and, get them lined up to be as healthy as they can be for their next pregnancy, if that's something that they want.
Right. And it is important. I know Christy's tying this into the chamber, but we are businesses, our small business, our larger corporations. it impacts in a special way. I'm a mom too, so I've had children before. So I know being off work or having any type of other issues prior to having your child, or after, post or pre, and it does impact the work environment. And to understand that businesses got to understand it's important to take care and have the best health care possible for your employees, so you can take care of your employees. In the long run, it makes a difference because employees are your greatest value and access. So you want to make sure that everybody, and even with the mom, she is, it's so important. Everybody's important in the household, don't get me wrong, but the mom is extremely important because she's the creator of life, and she also handles so much more. So it's important to make sure that we take care of employees and women, and especially pregnant women who are having these beautiful children, and to keep our community thriving. So it ties all together is what I'm trying to say.
Yeah, absolutely.
So, Thomas, do you have anything you want to share with us? I know we're talking women health and we're talking pregnancy, but I know you're a father, correct? Am I
That
assuming
is
right?
correct. That's
Okay.
correct. And
Oh, so and your
I
wife.
have a wife. We've had
Yes.
3 sons, and so yes. So I am just excited about the pregnancy cocoon care model, and that in this region, it is birthed out of the Georgia region. So this is a big deal for our region, for to have Dr. Gibson on. She is a trailblazer, and her and her colleagues in doing this. And I have so much respect for the body of work that they have done, that they are doing, and that they will do. It's going to mean so much to our future generations, and for women as well. And so this is just a thank you to the Henry County Chamber of Commerce for your partnership with us, for allowing Dr. Gibson to come on and talk about this very, very important, critical issue nationally,
Yes.
not just in the state of Georgia. This is a national crisis that we're in. And I'm glad and proud to work for an organization that is addressing this issue, and scientifically, and with technology, and on and on. So kudos to my colleagues in Kaiser Permanente and the Permanente Medical Group for what they're doing.
Yes. Okay. Facebook has a question. We have wants to know how to contact Dr. Gibson.
I can provide my email. Yeah, it looks like you've got my contact information, but definitely happy to share an email if anybody wants to get in touch with me.
Perfect. Thank you. Ravi, do you have anything you would like to share with us?
I don't know if I have much to share that other than that I am excited to once again be in partnership with this esteemed chamber. And I look forward, I cannot tell you enough, look forward to the Women's Empowerment Summit coming up on March 7th. I know it will be just as good as it was last year, and each year y'all just keep pushing the needle forward. And I'm just so glad that we can be a part of it, and that, we have a community, a true community partner with Henry County. So thank you.
Yes. And thank you again, Kaiser Permanente, for your sponsorship in so many different areas of the chamber. And we appreciate your support. It's not just your funding, but what you're doing for the community as a whole. I mean, it's very, very crucial that we have your involvement in this community. Henry County is so blessed to be with you and have you in the involvement in the community, because you have been there, you have stepped out, and you have helped, not just financially, but you have been a huge support in so many different areas. So we do thank you. Christy, you have anything you want to do to close out with?
Sure. I would just go ahead and also say, if you do want Dr. Gibson's contact information, just contact the chamber and they'll get you that information. But thank you to everyone that is on today. And it has been great learning about what Kaiser Permanente has been doing in this space and everything that they do for Henry County. So thank you guys so much for joining us today.
And
Thank
Dr.
you.
Gibson, do you have any closing remarks before we end the show?
No, I just want to thank you guys for the opportunity to come and share, what we're doing at, Kaiser Permanente. Definitely, if anyone has any questions, it sounds like you can contact Christy and she can, or the chamber, and, get my contact information. I'm always happy to share, what we're doing here, at Kaiser, and thank Thomas and Reve, for kind of giving me some of those opportunities to talk about what we're doing here. Definitely takes a, team effort. So there's a huge team, of people who've been involved, with this work. And I think that it makes me really proud to work for an organization that, again, really understands the, maternal health crisis and, has that commitment, to, putting resources towards making things better for our patients. So, I really share in the, the mission and the vision of Kaiser Permanente, and have been really appreciative that they have been so supportive, of this work. So just thanks all around.
No, and thank you once again. The work is phenomenal. My children are older, but I can definitely understand the need, and I can't thank you enough for what you do and Kaiser Permanente and your work and how important it is for the future generations as well. So thank you again. So at this point, again, we just want to mention the Women's Empowerment Summit on March 7th, which is a Thursday at Merrill Manor Convention Center. And tickets for the event, you can go on the Chamber page, their website, or Facebook under the Chamber to obtain your ticket. You really don't want to miss this Empowerment Summit. As you can see, we have such amazing women in the community that really like to pour into you. So the networking, the exposure you'll get while you're there, it's such an exciting time. The information that's shared, it's just women who are there to help support you and move you to the next level in your business and your organization. So come out and join us on March 7th at the Women's Empowerment Summit, which is Henry County Chamber. Thank you once again for being a part of Henry County Community Dialogue, sponsored by Kaiser Permanente. Thank you again for your sponsorship. And the DEI Committee for Diversity, Equity, and Inclusion Committee for Henry County Chamber. Thank you so much and have a wonderful rest of your day. Bye.
Okay.
Bye. Thanks again.
Bye. Thank you.